Okay, so Deborah is asking a question on nutrition care, the step that are involved in the nutrition management of a HIV and AIDS client. So basically, in this case, you're supposed to start with the first thing. You do the assessment. So remember, nutrition care, NCP, it's basically you start from assessment, diagnosis, intervention, and follow-up. That is the monitoring and evaluation. So Deborah is asking about the second step. This one is covering almost everything, and that is very true. You see, for example, if I say conduct a counseling and nutrition education session, this is supposed to be under intervention. So that is true, Deborah?
Yeah.
Yes, that is okay. Then prepare a food drug plan with the client or the caregiver. This is about like when are they supposed to take drug and when are they supposed to be eating. You find that some of the ARVs may interact with some of the nutrients. And you find also like there are some food that they need to totally avoid. For example, things like garlic. They're not supposed to be taking things like garlic since garlic has, garlic itself, it has a medicinal value, and some of the drug that they are taking may counter interact with the garlic itself. So there is, okay, we will discuss in details about ARVs and the things that they need to avoid. And also you find about a drug plan, they usually, for example, they need to keep a pattern. Like if a person takes his or her medication at 8 in the morning, every day it's supposed to be at 8. If they're taking 2 tablets in a day, for example, in the morning and in the evening, if it is 8 in a day and 8 in the evening, that should be the plan throughout. Like they're not supposed to vary the time unless in an unavoidable circumstances whereby maybe someone forgot, and those are the things that they're supposed to avoid. Things like forgetting to take the medication. It should be in a fixed schedule, in short. Then agree and carry out a follow-up plan. So in this case, like if you give a client like a certain date, the TCA date, in this case, it means that you were supposed to give them a TCA or a date to come again, a date whereby they also need to come and pick their medication again. Don't give them dates that are like it will make this person to be coming to the hospital so many times. So you need to have a plan, as in you need to have agree on and carry out a follow-up plan. You have to agree with your client when they will come, such that they'll be able to follow you that timeline. And also they need to come for a definite reason, for example, maybe to pick supplements if they are malnourished and so on. Not just to come like, they also have other things they're supposed to be doing and to take care of their family. Then refer a PLHIV means people living with HIV. So you refer people living with HIV for specialized care if necessary. For example, severe undernutrition, non-responsiveness. Like you've been trying to follow up a person for like 3 months and you find that their nutrition status is worsening. This person should be referred for further checkup. Maybe they have an underlying issue in their body which need to be checked and treated. So you need to refer them to specialists to ensure that, as in their health is supposed to be checked by all cadres, as in to ensure that there is whole, they are treated in a wholesome way. Hoping, Deborah, now your question is answered.
Yeah, it is answered.
Okay. So, okay, something else we were discussing in the last class, we are talking about counsel the client on the importance of good nutrition. This is very key. Remember, we were talking about what you're supposed to be telling a client, given that you are, as in, this person is visiting you as a nutritionist. So what are some of the things that you need to make clear to the client on good nutrition? One is that good nutrition, it helps the body to grow, develop, and repair itself. So if a person has been losing weight, for example, maybe in the asymptomatic stage, whereby they have lost about 5% of their weight, so you need to reassure them that good nutrition can be able to regain, as in it can help this person to regain their weight again. As in this losing of weight will totally stop if they observe good nutrition. Then Then also good nutrition need to feel stronger and look better. So this is something else that you need to, as in, you're trying to ensure that your client will be compliant in the nutrition. They will not just listen to you that time, and then when they leave your office, that's it. As in, they just leave everything in your office. Like, they cannot be able even to fit in. They cannot be able to follow your plan. So you need to ensure that you are able to get the attention of your client, and your client can be able to follow your diet plan. So in this case, you need to reassure them that even if you are on the symptomatic stage where you have lost more than 10% of your weight, you can be able to gain your weight back. Like, you won't continue losing weight, like something that is attracting attention for people to look at you. You even look more better. Then good nutrition helps strengthen the immune, regardless of the HIV status. Meaning, if the immune system is strengthened, they cannot, as in, they are not susceptible to very many infections. Like, they cannot just, as in, the body itself will be able to fight things like bacteria. For example, malaria, they cannot easily get it. Things like TB bacteria, the body can be able to fight it. The pneumonia bacteria, the body can be able to fight it. Meaning, they cannot just suffer from any disease that can come across their body. Their body can be able to fight it. Then it also may help to slow down the progression of HIV to AIDS. This is very correct, because if you're in a good nutrition, your body will be fit. Your body cannot, as in, if you don't get infections, the HIV, the progression of HIV to AIDS cannot occur. You find that you still remain just like a normal person. AIDS is the last stage of HIV. That is of the disease itself. So, meaning this person is having opportunistic infections. With good nutrition, you cannot be able to suffer infections because your immune system can be able to fight those infections. Then good nutrition allows you to remain productive, make you physically stronger, and enable you to do more physical activities such as household chores. Like, if that person was a breadwinner, they can continue working and providing for their family. Then good nutrition can help prevent weight loss. Good nutrition can help the body to utilize some medicine. That is very true. The medicine, they need energy. Some of the medicine to be utilized in the body need energy. And without that energy, that drug will not assist you. So once you reassure your client of all those things, they'll surely be able to follow your diet plan, or you catch their attention, and they will listen keenly, and that will be a very, very interactive session. Then for today, this was supposed to be discussed this week, the critical nutrition practices. The critical nutrition practices. So these are the key things that when you're having a client, you must address as a nutritionist. The critical nutrition practices, CNPs. This one, even if you go to, it is referred to as a CCC clinic. CCC clinic, they are clearly noted. You must talk to your client about these CNPs. There are 8 of them. The critical nutrition practices are 8. So which are these critical nutrition practices? The first thing, have a periodic nutrition status assessment. So this is something that you need to talk to your client, as you need to make them ensure that every time they come, before they get to your office, they must have their weight and height and BMI checked. So meaning, like, they can be able even to track their body, as in how is their body doing. For example, last time I came, I was 50 kgs. Today I'm 51. So they feel good that they are even themselves, they are improving. They must have a periodic nutrition assessment. Like, every time they go into the hospital, they need to continue checking on their weight, such that they can be able to tell whether there is a progress. And even themselves, they will appreciate your work. The other thing is increase energy needs according to the disease stage. Achieve additional energy by eating sufficient amount of balanced food, including one or more snacks between meals. Then severely malnourished, that is BMI below 16, people living with HIV and inpatients should be treated with appropriate therapeutic feeds. So increasing the energy needs. Remember, we talked about the increment in energy, which is supposed to be achieved depending with the stage. Remember the 3 main stages. They are symptomatic, the early symptomatic, and the late symptomatic. So in those 3 stages, you found that the energy increment was different. Some of them, they needed to increase more than the other because of the stage of the disease, and also the as in the position of their body. So in this case, there must be an additional food being taken by this person, whatever the case, even if they have the side effect of the drugs, like with something like nausea, vomiting, and so on. You must assist them to ensure that they are able to achieve their energy needs. And in this case now, this is where you find that if a person is severely malnourished, actually not only severely, we even have moderate. Moderate is between, that is between 18.5 and this 16. Those people who are mom, you also need to supplement them. We have therapeutic feeds and we have supplemental feeds. So they are different in terms of the energy that is giving to the patient. For example, I don't know whether you have ever seen RUTF. Have you ever seen RUTF in hospitals? There is this thing, oh, how is it called? Peanut. People, they do eat it. Have you ever seen RUTF, Deborah or Hafsa? Hello?
Yes. Yes,
You have
I've
ever
seen
seen it,
it.
eh? So in the,
Yes.
there is usually
Yeah.
RUTF and RUSF. RUTF is ready to use therapeutic feed. RUSF is ready to use supplemental feed. Apart from that, there is usually FBF, the fortified blended flour. It is usually a flour that they are supposed to make a porridge from it. So in this case, the supplemental feed that are there is that RUSF and the FBF, or it can be FBF or CBS. It is corn-based soy. It is also a flour. So these things, you find them in the hospitals. You cannot find them like in a school. When we go to the hospital, in most of the cases, we are shown those supplements. Apart from that, there are many other supplements. But the RUTF, together with the porridge, that is together with that flour, they are given together such that it's able to supplement, to make their body to regain their weight. So that is given for severe, but for mom, they are given the RUSF and the flour. Those things, they help them. They help to boost their body, because some of them, they may not be able to be working. Like, you're supplementing their diet, you're supplementing what they are eating yet at their home. Yeah. So that is about energy. Then number 3, this is point number 3, maintain high level of sanitation, food hygiene, food water safety at all time. Get dewormed twice a year. So in this case, you're trying to minimize any chance that this person may be having food hygiene issues, whereby you find that they may be suffering from the waterborne diseases. So in this case, you're trying to avoid diseases such as cholera, typhoid, because these will make their body to be weak, and you don't want that. So also the presence of the worms in the body. So they need to deworm themselves to ensure that they don't have anything that is interfering with what they eat. So that's why they need to maintain a high level of sanitation, food hygiene, and food water safety. In this case, they can even use, there was some time back in the hospital where they were being given, what is it called? Water guard. You have ever heard of water guard, whereby you're supposed to put like in one 20 liters jerry can, you're supposed to put only one bottle top of that car bottle. I believe you have ever seen water guard. Water guard can be in terms of liquid or tablets. So sometimes back, they used to be given those water guards, and those water guards, they help, like in the water, they were supposed to ensure that any water that they consume, it has been treated. Then number 4 is practice positive living behavior, including safe sex, alcohol avoidance or moderation or no consumption of junk foods, management of depression and stress, seeking support from the family and friends. This is about the positive living behavior. You need to ensure that this person is living a normal life, and there is nothing special for them. For example, this person is not supposed to, like, if this is a family man or family woman, they're not supposed to avoid things like conjugal right. That is the safe sex practice. They can use a CD, that is condoms. Then if at all they have to take alcohol, they're supposed to avoid alcohol. But some of them, if you tell someone to avoid, like, they may not achieve it, especially men. So they're supposed to reduce. Take it in moderation, like 1 bottle or 1 glass. That is enough for them. They don't have to take excess, the one that the body cannot be able to process or eliminate. So I also about junk food. Remember, you want to achieve.
Hello.
Oh, sorry for that. Sorry for that. It was my internet. Okay, okay. So let me share my screen again. Hello.
Hello.
Okay. Not we are not together. Okay, so we continue. So we were talking about, okay, you are trying to meet the energy need of this person. So if they continue taking junk, you may not be able to this person may not be able to achieve the energy and the nutrient requirement in their body. Another thing is about the stress and depression. So this is something that can be psychologically be achieved. Like this person can
Excuse me,
fear.
madam.
Hello. Yes.
Madam, I have
Yes.
a question.
Okay. Ask.
Are these junk foods, do you mean are they the snacks?
Okay. So the junk food,
Yeah.
it does, you can take a snack, but a snack be healthy. For example, when you take a banana as a snack, that is something which is healthy. But when you take, okay, junk food, these are food that are high in salt, high in fat. Are you getting that? And high in sugar. Those things,
Yeah.
those 3 things, that makes a food to be junk. For example, chips, that's a junk because it is high in fat and high in
Fat.
salt. Processed food, sweet,
Yeah.
as in things like sodas, and so on. Okay, those are things that they are only supposed to take them occasionally. That should not be an everyday meal. Then
Okay.
they should be able to seek support either from the family and friends. And this is where now even the stigma issue is supposed to be reduced and avoided, whereby people, they know about you and they have accepted you. And actually, in today's life, people, HIV it's not even a killer disease. People have accepted it and they are living with it when they are taking the ARVs. So there is the stigma issues that is something that is gone long time ago. It's only this person need to accept him or herself. As in, it's just a simple thing, just acceptance, and a person can live a healthy lifestyle. Then do physical activities, exercise to strengthen or build muscles and increase the appetite and improve the general health. So physical activity, they need to exercise at least 30 minutes in a day. Drink plenty of clean, safe water. So not just any water, it must be safe. So this is where you have either to boil or treat with water guard. Then number 7, seek prompt treatment for all opportunistic infections and other diseases, and manage symptoms with dietary practice, especially for illness that may interfere with food intake, absorption, and utilization. Seeking prompt treatment for any disease, not only like the major opportunistic infections, even if it's a common cold, a cough, they need to seek treatment to ensure that as in these problems are addressed early enough. Then lastly, if on medication, include ARVs, including ARVs, manage drug-food interaction and diet-related side effects. If taking traditional herbs or nutritional supplements, inform the clinician. So this is for a person who is positive, a person who is infected. So if a person is infected, like, they must inform their clinician whether they are using any herbs. So for you as a nutritionist, they have to inform you whether they're using any herbs also and nutritional supplements. We have some herbs that interact with the drugs, with the ARVs especially. So as in, you need to be aware first, and then such that you can be able to tell them whether this is correct or it should be avoided. In most of the cases, they are not supposed to be taking any traditional herbs. Yeah, so those are the 8 critical nutrition practices that when you're addressing a HIV person, you have to ensure that it is clear to them and it can be followed. Then we have a table which is trying to summarize and also adding, as in, it is making this very, very, very clear, like what should be done and how it should be it should be done. So you see the 8 CNPs, like for example, number 1, we have a periodic nutrition assessment done. So how can you achieve these key messages that you're supposed to address? If you have HIV-related symptoms, get weighed every month. If no HIV-related symptoms, get weighed every 3 months. So unintentional weight loss or gain may imply poor health and may lead to hospitalization. This is the reason why taking of weight is very, very key. The other one is keeping a record of your weight. This allows you to track your weight changes and take action early if there are problems. Then seek clinic care if you lose more than 6 kgs of weight in 2 to 3 months. So such quick weight loss indicates poor health or eating habits. So in this case, all these things, it is on the assessment. Why is that person supposed to do that and the explanation towards that. So this is making very easy for you to understand the interpretation toward each and every CNP. Are we together? So
Yes.
number 2 is about on the energy. You see, how can someone be able to meet? You see, number 2, here we have several ways in which a person can be able to meet the energy. The first one is eat locally available and affordable food from each of the food groups to diversify the diet and increase the energy intake. Number 2, eat 5 times a day, meaning you have the 3 main meals and 2 snacks. Remember, when we're talking about snacks, this must be a healthy snack. Then eat food from different food groups, not only one food group. Remember about the varieties, the spice of life. So if today you take ugali, the other meal take rice, the other meal take bananas, and so on. So take food from different food groups. And then enrich meal with energy-dense food such as groundnut paste, oil, or fat, sugar, and honey. So enriching of the diet. For example, when you're taking a porridge, your porridge can be having groundnuts, as in which is milled together. Addition of something like oil in food, that is very key. Sugar, you can as well add, or you can add honey or even milk in your diet. This is ways of making your food energy dense. But remember, this is for a person whose weight is going down, whereby you can even add sugar. But ensure that this person is not using excess. Eat supplementary food that contain high level of energy, protein, and micronutrients, such as corn soy blend. So like I was saying, there is usually a flour which they are given, which is made up of corn soy. So if available and affordable. If you have no appetite or are not eating enough, ask for help. So that was number 2 point. The table is expounding on the 8 steps. The 8 steps, all of them. So we have number 3, the drinking of plenty water. I won't go into detail on them. Like you can literally be able to see how this person can be able to achieve all these steps. Are we together? Hello?
Yes.
Is there any questions so far?
No.
There is no question. So I assume you have understood, or you will understand as you write notes. That is true.
Yeah.
Yes.
Okay. And in case of any question, you will ask later on. Yeah, so basically that's all for today. You can have a good day.
You too.
You too.